It's me again. Since I've had such a lovely feedback from my previous live video, I thought I would come here again to show you the herbal tea I'm making for a patient who's suffering with post-viral fatigue. She had a very strong viral infection. She also has a history of bacterial infection in the lungs, type of pneumonia, and she has taken already quite a few different antibiotics, a few which weren't effective at all because it tends to this Pseudomonas bacteria that she has can be quite sort of resistant to antibiotics. And when we are dealing with such complex cases as herbalists as well, we tend to vary the herbs we use to tackle the pathogen from different angles. But before we get to that, I would like to show you a bit of my dispensary. Okay, so as you can see, or not see, it's a bit blurry, there we go. Many different herbal tinctures that I use in my dispensary. About over 150 different herbs, powders as well, and many lovely herbal books. And more of them here. And essential oils. And over here we have all sorts of dried herbs. That's the herbal tea I'm making. And as well a few herbs that I have pressed myself a long time ago during my degree. You can see they've gone a bit pale now, but they're still beautiful. This is actually shepherd's purse that we looked at before. And you see the beautiful little heart leaves. As you can see, shepherd's purse, the anti-hemorrhagic herb, beautiful. Got elderflower, which is actually in the herbal tea. We use the flowers, the yellow flowers, for hay fever, for fevers, to improve sweating, any chest infections. There's cleavers, remember cleavers from the garden, the sticky herb, goosegrass with the tiny flowers. That's lady's mantle, which looks much prettier when it's not dried, because there's often shimmering dew on top of it. Beautiful herb. There's chamomile experiment, German chamomile, and stinging nettle, and there's female and male for that. And a few of my qualifications, and a beautiful painting of a well-known herbalist called Christopher Headley, who was very dear to all of us, and yeah, a few other bits and bobs. Right, so let's get to the herbal tea. What have we got here? So I've already made a tonic. This is all full of a few different herbs chosen individually for this patient. It's anti-infective herbs, antiviral, as well as adaptogens such as Schisandra, ashwagandha, to help with this post-viral fatigue that we tend to see so much of nowadays. It can take so many weeks, sometimes months, to get our energy levels back to 100% after a strong infection. In terms of the herbs that I chose for her herbal tea, this is a repeat of her prescription. We've got 200 grams here. This is freshly ground cardamom. It smells absolutely amazing. Helps to reduce congestion in the lungs, in the gut. It helps to break down the phlegm, sputum, especially if you're a bit intolerant to dairy but still having some. It's really helpful if you have some cardamom in your diet. Traditionally also, if you're thinking of the chai herbal tea, it's the cow's milk mixed with cardamom, and that really helps to reduce some of the bloating that you might get if you do consume dairy. There's thyme. Remember the thyme in my garden? It looks much smaller when it's dried. Organic thyme. They smell so nice. Again, antiviral. Great herb for any lung issues, chest issues. And this is a rarer herb that you don't see so much used in herbal medicine, but I really like it. It's Iceland moss. It's not really a herb as such, but yes, Centraria Icelandica is the Latin name. It's a great demulcent herb for the lungs. So demulcent means soothing for the mucous membranes. So when you've got all the irritation from coughing, you need some really soothing herbs to soothe that cough. And it's also great for recovering after pneumonia and just general convalescence. Here we have holy basil, tulsi, beautiful tulsi, sacred Indian herb, and a great anti-allergic herb. Herb that helps with immunity. It also helps with low mood, energy, and it tastes great. And guess what? Elderflower. And elderflower grows everywhere at the moment. You can just pick the flowers. You know, it's got such a typical smell. You can't really, once somebody shows you which one it is, you can't really forget. You can make your own cordial. You can just add hot water over the flower head to make herbal teas, and it's a herb that we use traditionally for hay fever. And funny enough, it's blooming at this time of the year when so many people are suffering with itchy eyes and throat irritation and sneezing and the other issues that we get with hay fever. Lovely diaphoretic herb, meaning it helps with sweating, as we mentioned before. And some fennel seeds. Fennel seeds, again, they taste really nice and sweet without actually having any sugar in them. It doesn't affect blood sugar levels. It's a lovely herb that can be used by breastfeeding nursing mothers to improve breast milk. You can also use aniseed and fenugreek for that purpose. You can just chew on the seeds to freshen up your breath. Very, very nice. And again, you can use that in your cooking as a carminative herb to reduce bloating, to help with flatulence, gas, cramps. Lovely, lovely herb. And it also helps to reduce coughs. So that's what herbalists usually do. They choose 5 to 6 different herbs specific for the patient, depending on their blood pressure, depending on whether for instance with coughs, whether their coughs are let me turn back. There you go. Whether it's a dry cough or productive chesty cough, whether the thyroid function is optimal or a bit too high or a bit too low, because herbs have different actions. So while we can use a lot of herbs to, for instance, improve digestion, it's always better to choose the ones that will do much more than working on one health issue. Herbs are very nutritive, and they can be taken as food as well. And most of them are very safe, but of course it's always best to check with a health professional, including medical herbalists, particularly if you're taking any medication or suffering from any serious conditions, or pregnant or breastfeeding. It's always best to consult a herbalist first. But yes, there's so much that herbal medicine can do to help most people, and I hope this little video inspires you to learn more about herbs, to drink more herbal teas, and to get healthier through that. Hello, Lee. Gonna wave. And if you have any health questions, I'm really happy to answer. I practice in Gravesend as well as Strood, Medway, and I'm also currently working remotely through Zoom consultations over video, and I help people with a wide range of health issues, from unexplained infertility to IBD, which stands for inflammatory bowel disease, such as Crohn's and colitis, to anxiety, depression, indigestion, weight loss or weight gain. Yes, most health issues can be improved, and there's always something that can be done to help somebody feel better and to help their body be more nourished and in a better shape. So thank you for watching. I'm going to finish making this herbal tea. Okay, I do need both of my hands, so I'm going to let you go before I pack this up. But thank you for watching. And if you enjoy this, let me know, and if there's anything particular you'd like me to speak about, I'd love to hear it. Bye bye. Hope you have a nice evening.